All right, Dr. Shah, I haven't seen you for a while because you have a new look going there. Oh, all right. Just for the group, Dr. Shah and I are like right next door in our patient care offices. We used to see each other pre-COVID. Okay, I'm gonna wait 2 more minutes and then we will get started because zip, 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 we have more and more people on. All right, I think we're going to go ahead and get started. This is always a very odd thing to do, to look at a camera instead of all of your faces. So you guys know me, right? I'm Dr. Baker. We are going to have a town hall here, and I'm going to be asking for the question and answer session. I have Dr. Romero, Dr. Konety, Dr. Zwecka, and Dr. Levin who will be available to answer questions. I am not sure if Dr. Konety, are you on, and would you like to give a greeting to everyone? So I would like to introduce our dean. You guys, I think, have met him. At
He
least
said he said he's here and he's asking to be unmuted.
That's, I know, don't, it's not me. I will not be unmuting anyone. Has been here since July 1st and will say a couple of words as soon as Judith manages to unmute him. Badri, is your mute off yet? I guess not. Dr. Romero, would you like to say a word or two?
Yeah, thank you. Can you hopefully give me a thumbs up or a head nod if you can hear me? Good, thanks. I also think Badri is unmuted at this time. Maybe Badri, you're on mute on your end. But yeah, I'll say a few words. Just, I want to thank everybody for all of their hard work, obviously, during this very trying time. It's like, here we go again. We never really came out of it, but we're right back into COVID phase 2. And, want to thank everybody for all of their hard work, their dedication, and for hanging in there as we try to figure out next steps as we move along, whether it's finding the best learning environment for the students or for the, places for the faculty. So hopefully we can get to some of those questions here, answer some of your questions, and that's it. Thanks, Beth.
Yep. Dr. Konety, are you unmuted? Evidently not. Okay. Judith, I'm sure will come let me know when he is unmuted. I'm going to start sharing my screen.
Hi, Beth. Can you hear me now?
Oh, now we can hear you. Yes, okay. Dr. Konety.
My camera is not working, and neither was my microphone, so I'm just sort of MacGyvering something here. But thank you. First of all, thank you, Beth, for thinking of this and bringing us all together. I think it's a great idea, and thank you, Dino, as well, and everybody else for being on. I also appreciate all of you students taking time at the end of the day to sign on. And I want to echo both Beth and Dino's concerns. We're all in the middle of, obviously, the second surge and all sorts of pressures from all sorts of different directions. So we recognize that these are extremely trying times, but yet we're glad and happy that you're all well and able to sign on to this in this difficult time. We just wanted to take some time to understand from you and learn from you how you're doing, what your concerns are now, and how we can help you. And if we can't help you, we can hold your hand while we're going through this, because unfortunately we all don't know all the solutions to everything. But given what you've heard in the news with the 2 vaccines coming on board, with Regeneron coming on board, at least I think we're beginning to see the light at the end of the tunnel for this whole pandemic at some point, hopefully at least by in the next 2 to 3 months. And I think there's a light at the end of the tunnel in more ways than one, depending on your political leaning. But at this point, I think in many ways, this will be a winter of reckoning, and then after that will be a better time. But I'll stop there. We want to take your comments, concerns, and just listen to you and see how we can help you.
All right, so I thought by giving you guys, I'd start by giving you guys a few facts and talking a little bit. Can everybody, I'm sharing my screen. Can you guys see a PowerPoint slide? Dr. Zweck, I can, you can't. Oh boy.
Not yet.
You can certainly see that I am there, share, there. Now I think I had to hit that little share button. Is that right? All right, now can you see it? Yep.
Yes.
Okay, great. So that's who's on the call to help answer questions today. I'm going to just present a few things, and then we're going to have some questions and answers, okay? I am sharing my screen to the right of me, so I'm looking to the right is because I need to see my screen. So the first thing I want to do is, everybody's stressed, but I want everybody to take a minute, sit back, take a breath, and remember all the things we have to be thankful for, and remember all the people we should be thanking. So the first people I want to thank are you guys, the students. You have really hung in there. You have been resilient. You have been flexible. We have had to change and change and change again, and we're probably going to keep doing that. And I'm really impressed and proud of you guys for doing that. I would like you guys, though, also to take a moment to feel thankful for people. We have basic scientists who have literally been working sometimes 24 hours in a day to try to get stuff ready for, for your sessions. And I want you to really appreciate that. Your clinician educators have been working harder clinically than ever and coming and trying to work Zoom sessions. And that's something, along with your behavioral scientists. There's also a whole group of people in the OIME, all these education coordinators and managers. You might think, well, I'm just sitting at my house, but everything didn't just pop in there by itself, and they are working so hard. Your clerkship directors, I've been exchanging emails with clerkship directors all day today as things have been going more topsy-turvy than ever. And so they are working super hard along with the coordinators and all the teachers that you've got up on the floors. We have an assessment team that's had to move everything remote. Is going remote, and we have all the deans and directors that I really want to take a moment to thank everybody. So take a minute, remember that this is a huge team effort, and we should really remember that. I also want to take a minute to make sure that we recognize that this is a time where wellness is really hard for all of us. So those are just some emotions that I was thinking about what sort of is impacting my wellness right now. We're all stressed, we're all fatigued, and we've got COVID fatigue, and we're all afraid. I mean, everybody's a little bit afraid right now. We're afraid of making the wrong decisions. We're afraid of getting sick ourselves. We're afraid of somebody we love getting sick. So, that's tough. But remember that we also have empathy for each other as human beings, and we are trying to help everybody, whether it's in education or whether it's in taking care of patients. Hopefully, we all still have passion for what we're doing. I know I do. And I feel a lot of compassion for everything that's going on. And lastly, I think for me personally, based on the things that have happened in the last month, despite the new surge, is I'm starting to feel hopeful that we'll see the light at the end of the tunnel. What can you guys do to try to keep yourselves well? And we'll give you some resources. I'll talk about that, but just these are the 4 things that I think about myself when I think about what I'm going to do to stay well. One is I try to remember the meaningfulness in what we do. We actually all have really meaningful lives compared to what a lot of people are doing. We're in healthcare at a time when taking care of people is never been so important. So try to keep that in mind. Something that I know is challenging right now is the interconnectedness we all like to feel with each other. And that is hard to do remotely, but I want you to all, give that a thought and think about how you can connect meaningfully with one another. I can't connect you guys together. You have to connect yourselves, but I'm happy to help connect you with us. And we want to make sure we're doing that. And then you have to take care of yourselves. everybody's got to take time. You can't Zoom 24/7, though sometimes I think I'm trying to do that. And you have to do some recreation. So, you know, I'm exercising every day. I'm getting out and walking every day. And, you know, so you gotta get outside to do something, and you got to take care of yourselves. All right, some statistics. So let's talk about COVID. It is here. So these are statistics from today. 55, actually went up to 56. I just looked. 56 million cases worldwide, you know, more than 1 million deaths, 11 million, 11.5 million in the US, and 600,000 in Illinois. And you can see what the numbers are for the past few days. So this is a surge, and the surge is definitely strong in Illinois. At Rush, our COVID numbers as of today, we were down as low as about 15 inpatients at our lowest. We're now back up to about 94 as of this morning. We have a positivity rate of about 16%, which you guys know we'd like it to be 5. So that's quite a bit higher than where we'd like, but it's not terrible. And we have about 17 patients on ventilators, or we had this morning 17 patients on ventilators, which is not good, but it's also not terrible. Some of the good things is that the last time we had the surge in Illinois, there were many, many more people at Rush and not so much around everywhere else. I mean, everywhere else had more too, but this is much more even. So Rush and Copley, Northwestern, lots of hospitals now are sharing the burden more equally, which hopefully means that there will be enough resources to be able to take care of everybody through this surge. I am going to share some statistics about Rush University and the students. So we do get I get daily updates. I'm not giving you a daily update because it would make you nuts. And also, I don't want to, you know, shout out to students who've turned positive. But as you can see, and I had to put these in because I couldn't make this larger without making it get blurry. Over the entirety of our time taking note of these, we've had 89 confirmed positive COVID cases within the whole university, only 21 over the past 7 days. Rush Medical College, though, which is the third one here where the arrow is, has had a total, since we've been counting, of 14 students. Now, for those 14 students, and some of you are probably on this call, I am sorry that you've, you know, had COVID, and so I don't mean to take this lightly at all, but 14 out of more than 500 students is still a pretty small number. So you guys are doing a great job of keeping isolated, of socially distancing, of wearing your masks, I can tell, because the numbers remain pretty small. Doesn't mean that every one of those is not important, and it doesn't mean that we don't want to try to prevent what we can. You can see on this graph that the College of Nursing actually has the predominant number of positives. That's the first bar. What you guys need to know is that in the College of Nursing, they have a large number of graduate students. So they've already had their RNs, and many of them are working. So I think that and many of them work across the country, not just at Rush. So their numbers are larger, but they also have some a lot of nurses in very high risk areas that, and their numbers are larger, but not terribly large. I am going to take a minute. I'm going to, I hope, stop sharing this screen, and I'm going to go over to, I hope, here where I'm going to share, oops, hold on, share another screen, hold on. Let's see, can I do this? Yeah. Okay. So I get a lot of people telling me that there's no information about COVID. We don't have enough information. So I want to make sure you guys understand everywhere you can get COVID information. Here are the COVID updates on Inside Rush. And if you click on this, hopefully, you get all sorts of things. So please utilize the Inside Rush page if you'd like. You can also go to the Rush University page and look at this. There's an entire COVID alert thing that has all of our campus reentry plans. It's got all sorts of things in it. Please use this page if you're feeling like you need some information. We can also go the Rush Medical College page. And if you go in, I have to go in as faculty. You can go in as a student. You can log into the portal now and look at this brand new portal page, which is actually pretty nifty. Here's the university where you have COVID information right here. And if you go to the Rush Medical College page, there's the COVID guidelines and facts. If you go in here, I should have backed up for a second. Let me go backwards for a minute. You go backwards, I want you to notice a couple things. So we are trying to be as supportive as we can in doing that. We've opened up office hours and we have somebody on call all the time, and it's right here on this page. So if you are having a need, you feel like you want to drop in, you don't want to make an appointment, and you want to see me, you can see me just by on Thursdays. No, when am I? Yeah, on Thursdays, I am just in the office or on Zoom. On Wednesdays, I'm here, so that's why I'm actually here. I may not be in the office depending on whether I can be in the office or not, but everybody's here, and we'd be happy to meet with you guys at any time. I do want to take a few minutes and go through some of our COVID guidelines. I'm going to go over some of these the M1 and M2 guidelines in more detail, but you guys can see we've updated this, and we're going to keep it continuously updated. So this is a place that you can get information, and you know this already. We're remote via Zoom for the M1 and M2s. Our anatomy is still taking place in person through next week, along with some physical exam sessions. And then after that, you guys are going to be remote until after the first of the year. And clinical experiences have all been put on hold for you guys. The M3s and M4s are still on campus. Those not at Stroger now. We're all here, you know, that's what we're doing. And you can read the rest of this, and I'm going to talk a little bit about that more. I want you to understand, you can see the general guidelines. And what have people been asking me? They've been asking me, are we supposed to be doing that COVID pass thing when you come in? And we would like you to be doing that. We're not mandating it, but that's something we'd like you to be doing. I want to remind everybody that asymptomatic COVID testing is available, and that's how you can, it's right there if you can't remember how to get it. I've had a lot of questions about how often people are supposed to be screening. We're asking students who are going to be in the academic facility to every other week. So once every 2 weeks, get a test. That's an arbitrary number, but it was made so that we think we can accommodate everybody by doing that. Clinical students, you are welcome to get tested, and you should if you have any concerns. We are not mandating or even recommending every 2 week testing for our clinical students, because we're not doing it for all the employees every 2 weeks. And that may change, but you are welcome to get tested, and you should feel free to do that if you'd like every other week. To remind people, if you get COVID type symptoms, you need to get tested. If you test negative, you still have to stay home for at least 3 days until you're better for 3 days. If you test positive, you're going to be out for at least 10 days. And you will be talking to us, so you will know if that happens. If you get exposed to COVID, you are considered non-essential at Rush, which only is a category that means you have to quarantine for 14 days. I want to be really clear what an exposure is. An exposure is only these 3 things all together. You have to have your mask off, be within 6 feet of somebody, and more than 15 minutes in a 24-hour period. So most of you guys, if you are exposed to somebody it's that you really don't have that kind of, you don't have a quarantine exposure. You may have an exposure that means you should go get a test. And we encourage everybody to get tested if they've had even a brief exposure, but you don't need to quarantine, and we're not considering that an exposure, okay? Travel. This is a tough one. Next week is Thanksgiving, but I'm just going to put it out there. We are not restricting people, but we are discouraging it. My preference would be that if you're going to go home and stay home, then absolutely go home, stay home through the first of the year and come back for the new year. If that's not an option for you, then don't go home. Don't go anywhere. Stay in your house. I myself have 80-year-old parents. They are mad at me right now because I didn't invite them over for Thanksgiving, because I see patients and I feel like I am too high a risk for them to see right now. So I'm having Thanksgiving with 3 people. My one daughter who is coming home from college, then she's staying home through the first of the year. And everybody's got to make their own decisions, but that's the recommendation, okay? If you do leave Chicago and you come back, you are mandated to follow the 14-day quarantine rule if you go somewhere that's got a quarantine. And if you know right now, the state of Illinois has got some quarantine states and they've got some testing states. So you'll need to understand what the guideline is for when you go home. Guidelines for socializing. A lot of people have asked me about this. I am not your mother. I am somebody's mother, but I'm not your mother. I would like your bubble to be small, but it needs to have some people in it. So if you've got a bubble of 1, that's probably not big enough. If you've got a bubble of 15, that's too big. I'd prefer your bubble, and those are the people you take your masks off, to be 5 or less. That's what I would say if you're going to ask me what I think. It needs to be 10 or less. If it's more than 10, then that's way too high. All right. So those are the recommendations. They're right there. So you can go to them and feel free to look at them anytime. The other thing I want you to know is right on here, and in many places, there are resources for wellness. So the Center for Clinical Wellness, there's a link. The Wellness Assistance Program, there's a link. Perspectives, there's a link. Oh, and Stress Busters, that's from Dr. Beal. I'm not quite sure what that is, but there's a link there. And then there's some frequently asked questions. Finally, I do want to emphasize that professionalism is really important here. And my expectation is that you guys are wearing your masks. You are not gathering in large groups. I need you to do this. We are not going to get through this if people are not paying attention to these rules. If I find out that people are being unprofessional, I'm going to treat it like any other unprofessional behavior, and you're going to go to COSEP. What's COSEP going to do? Well, that's absolutely up to them, but that is what's going to happen. Okay. I am going to share one more time my other screen, and then we're almost done. Oops, almost done here. Gosh, sorry, shoot, I just did something bad. All right. Can you guys, hey, Dr. Zwaka, tell me what you're seeing right now, because I've lost my picture.
See slides.
You're seeing the
changes in state of affairs. Yeah. Now you're back to the start.
Can you show it?
There we go. Okay, so you can see curricular changes in state of affairs. All right.
Yes.
All right, so I'm going to let Dr. Levin and Dr. Zweka give just a 5 minutes on what's going on in the M1 and 2, and then in the M1 and 3, if you want to add anything to what I've already said. Dr. Levin.
I don't really have too much to add. You know, what's on this list is pretty much our situation right now. The only thing I would add is for the M1 students, we do have what is scheduled to be a on-campus physical exam event on the 14th. We're trying to make that later, so we haven't forgotten about that, because for those students who are traveling out of town and have to quarantine for 2 weeks when they come back, we don't want to make you have to travel like on December, on New Year's Eve or something like that. We want to allow you to finish your break at home if that's what you want to do, and then travel and have then still 2 weeks before any session that you have to be on campus. So it hasn't been changed yet. It's very tricky in terms of the space that's available and the faculty that's available, but we are continuing to try and make that later so that for anyone who comes back after New Year's to Chicago, you still have 2 weeks that you can quarantine before we would ask you to be on campus. For the M2s, it's already about 3 weeks after the end of the winter break that you would first be asked to be on campus. And again, of course, as we all know, what we'll be expecting you to be on campus for, not on campus for by January may or may not be the same as it is now. But other than that, I think that there's really nothing else I can add, but happy to answer any questions when we get to that time.
Perfect. Dr. Zwecka, do you want to give a quick rundown on the M3, M4s? I'm sure we'll have questions, so we don't feel like we have to tell them everything.
Absolutely. So as you all know, the loss of Stroger has required quite a bit of reshuffling. The clerkship directors and coordinators have been hard at work to make sure that everyone has a clinical experience in their current clerkship. It's hard to anticipate, where things are going to go and how things are going to work out. We will continue to shuffle because our number one priority at this point is to keep you in the clinical environment as long as it's safe to do so. We are working on, the clerkship directors have really worked very hard to be innovative with their clinical experiences, so that you have what you need in order to be competent in the clerkship that you're working on and be ready to take shelf exams. And otherwise, it's all on here, so might as well say it. We are working together. We've convened several groups to talk about assessment and grading in the third year, and no final thoughts at all. We're just having a discussion, and we'll be continuing to do so over the next several weeks.
All right, thank you. Why did it do that? All right, couple closing things before we get to questions. So that's my cute way of saying, I know that many of you have very strong opinions about where we should go and what we should do and exactly what's right. But I will promise you, if I put 100 of you and asked you to tell me what your feeling is about clerkship grades, or what you're feeling about should we all be remote or not, or what you're feeling about whether we should change groups or not, you're going to have as many people on one side as on the other side of the equation on those things in which everybody's in agreement. We're having an easy time with those things. So just remember, I'm just asking you to keep in mind that it's really hard for us to please everybody. We can't do it, that we're doing the best we can. And that's why we're having this town hall, so we can gather some information and figure out what's going to be best for you guys. But if we don't do exactly what you want, remember that maybe exactly what you want is not exactly what everybody else wants. And we are doing our best to communicate. And here I am if you want to communicate, and we've now got time for questions. So I'm going to stop sharing that.
You're muted.
Am I on? Now you have the capacity to unmute yourself if you want to ask a question or use the chat box.
Judith, I can you hear me, Judith? Can you? Okay.
Yes, we can, Dr. Romero.
All right, thank you. Yeah, there was a question on there about vaccination, so I could talk about that real quick. As a student of public health initiatives, this is an interesting topic that I'll boil it down to something easy, even though I anticipate this will not be easy, and there will be a lot more discussion on this. So right now we have 2 vaccines that appear to be ready to go for FDA approval. There's a third one right around the corner. If the first one gets FDA approval, it could be ready by the end of this year, as soon as the end of this year, more likely beginning of 2021. It appears that we're not going to have a choice on which vaccine we get to pick. It's going to be given to us. And when the supplies are given to us, we'll have to decide how many. It's a 2-tiered vaccination, so it takes 2 shots, one and then the second one about 3 weeks later. So we're going to have to figure out based on dosages who goes first. It's an interesting topic. You know, right now what you'll hear in the news is they want healthcare workers to go first. You know, with the disparity in deaths due to COVID, you can make an argument that other more at high risk populations go first, but I'm sure that will lead to a discussion of experimentation in the community, which we also don't want. So the balance in here is going to be very tricky. I do anticipate, like most of these vaccines, they will give them the healthcare workers first. Legal has already weighed in. We cannot mandate this vaccination like we do an influenza vaccine. So we can strongly suggest it. We cannot mandate it. And then we'll have to figure out by dosages who we can offer it to. Frontline workers are likely to go first if we stay with the healthcare worker first rule. And where the question goes on to where do the students fall in that? Honestly, at this point, I don't know. I'm not sure anybody knows where students fall in that. And there's probably some subclassification, you know, based on, especially in medical students, right? So if fourth years, third years, second years, first years could fall out into their own hierarchies. And that may be different than, for instance, the College of Health Sciences, the Graduate College, the Nursing College, undergraduate students. So it's a discussion that we have our finger on the pulse of what's happening in that discussion, but we don't have all the answers yet. As we get them, we could fill that information into the different portals and through communication through this group. Thank you.
Thanks, Dino. I see a question about the emergency medicine rotation. I'll throw something in there and then I'll let Dr. Zwecka and probably Dr. Patwari, who I now see, who could throw an answer in here. So the emergency medicine rotation is like all of our other clinical rotations. We're looking closely at density of students, trying to keep things so we're spreading students out more. We're making sure that we have adequate PPE. And so whatever PPE is deemed necessary by Dr. Rumoro, who's the emergency medicine chair, by Dr. Patwari, who's the curriculum dean, it will be worn, you know, by everybody, which right now is masks, shields for everybody, and full PPE for COVID positive patients. We know there's a higher prevalence in the community, so it's, you know, behooves everybody to be particularly safe. And, you know, that's what we're doing right now. But I do want to say, as a general internist, I'm in the office seeing patients, you know, several times a week. I think if everybody masks, if you mask and you have on your shield, so now we have shields, that's pretty safe. If your patient's got a mask and you've got a mask and a shield. If I didn't, is it perfectly safe? Absolutely not. There's nothing perfectly safe in this world right now. So I can't tell you that it's perfectly safe, but do I think it's reasonably safe? Yes. If you feel like you're not safe, if you're a very high risk person and you feel like this isn't something that you want to be doing, you need to let us know and we'll work with you for that. But that's where we are right now. Dr. Zwecka or Dr. Patwari, do you want to add something to that?
Yeah, I don't really have anything much to add to that, but we'll be continuing to monitor the situation. And I just echo what Dr. Baker says. Feel free to reach out if you're concerned because of medical issues or anything else that you have going on. I'm happy to discuss.
Yeah, so as far as taking care of COVID patients goes, right now we're discouraging it, but I'm not telling you can't do it. You are a healthcare professional and you can make up your own mind about that. It's not gonna be a requirement for any Rush Medical student, and it's not something we're actually encouraging because it requires more PPE and other things. But if in your role as a medical student, you have the opportunity to take care of a patient or to go see a patient with a neurologic condition who has COVID, and that's something that you feel you want to do, you may do it. I don't believe there'll be any coercion by anybody. Certainly I wouldn't allow that, but if anybody felt there was, I would want to hear about that right away. If you are a high risk person, and that includes those of you who have more than minor asthma, you absolutely should not be seeing COVID patients, and you should very much steer clear of that. And you need to let us know if you're immunosuppressed. You absolutely should not be taking care of COVID patients, and you need to make sure that you're not. And if you need to talk to Dr. Zwecka, your clerkship directors, others, to make sure that's not happening, we need to make sure that it's not happening. Rahul, you want to add anything else for the ER?
No, I think you covered it. If there's anything particular that anyone has, feel free to email me.
All right. I'm going to let you answer this one, Amy. Dr. Zwaka, is transition to residency going to be virtual?
I don't have an answer for that quite yet. We know a piece of it will definitely be virtual, but here's the big but, which is that there are clinical skills that we want to make sure that you have before you go to your residency programs. And the only way for us to train, teach, and test your clinical skills is in-person simulation. All the big group sessions absolutely will be virtual, but we are trying to create a schedule in which there will be perhaps some limited simulation sessions, because we do think that if we are able to test those, then we would like to. If that changes, I will absolutely let everyone know.
Okay, I had a clarification about what an exposure really is, and this is hard. So, if you feel confused because it seems like you're getting confusing information, it is tough to decide. So there is a range. It's not I was exposed, I wasn't exposed. It's what we're deciding is there's a degree of exposure that's enough that we're going to pull you off your rotation. We're going to pull you out of the classroom. We're going to make you quarantine for 14 days. We do know that minor exposures, passing somebody in the hallway, sitting in a restaurant where somebody's at the other end of the restaurant and you're at one end, is different than a major exposure. So a major exposure is one or both of you don't have a mask on. And I think it's probably worse if the other person doesn't have the mask on because they're the ones spewing COVID at you. You're less than 6 feet away and it's more than 15 minutes over a 24-hour period. Okay, so if the other person isn't wearing their mask, that's actually probably a higher risk than if you're just not wearing your mask. But either one of those, either people not having their mask on for 15 minutes. If it's 2 minutes, again, is there some risk? There's some risk, but it's not a very high risk, and it doesn't meet that standard of needing to quarantine. You may say, I would feel better getting tested, and then absolutely you should get tested. And remember that you can turn positive up to 14 days after an exposure, and that's why that's the quarantine period. So if you get tested right away, that's fine. I think it's about 7 days generally, kind of the average before your test turns positive. You're going to need to get it done again at 7 days, and then to be really sure, get it done again at 14 days. If you want to, if you're going to use testing as a reason why you're comfortable that you don't have COVID. All right.
I see a question there about the second wave of COVID relief funding on the chat. If I may, maybe I can comment on that. That's a great idea. We have actually, I know that the university is thinking about that, and we've sort of broached some topics with the potential donors. So we don't know yet for sure, but that is something that definitely we're considering trying to figure out if we can get access to more funding through the alumni and other donors who are the ones who contributed the last time. So hopefully, we cannot promise anything yet, but we're working on it.
Yeah, it's been really touching the number of donations we've gotten from alumni. Alumni did a fair amount of providing the funds for that relief, and we got relief from several different areas. And so I'm also hopeful that, given a new administration in this country, that it's possible that there'll be a relief package that would actually bring some more relief. So I think we've got some things to potentially be optimistic about. I do see a question about what about next year, or what's going to happen in the future. So I'm going to, get out my crystal ball and give my best guess. So my best guess is that early in the year, we will start to vaccinate people, that vaccinations there won't be enough of them that we'll see much before the spring. But it's possible that starting in the spring, things will start to get better. It's possible that we'll be able to do something in small groups in the spring, but I would not count on that. But it is possible. I'm positive that we're not going to be able to have 500 people together in the spring. I mean, I think that that's a foregone conclusion. Will we be able to have groups of 10 together and do something limited? I hope so. So that's the spring. And I'm more than a little hopeful that in the fall, we'll be able to have some type of group gatherings. Might not be the whole class, but that we'll be able to do something, because I think in the spring and summer, as we start to vaccinate more people, assuming the vaccine works, has the high efficacy that they think it does, then I think that small groups and slightly larger groups will become possible over the course of the following academic year. Now, having said that, do I know what's going to happen? Absolutely not. Do we know if the vaccine's going to work? Absolutely not. Do we know if COVID is going to mutate in some way that we're not expecting? I absolutely have none of those answers. And so I'm only giving you, if things go along according to plan, how we might see things happening. And I did have the opportunity to hear Dr. Fauci this week, because I was at the AAMC meeting, sitting right here, but on my screen was the AAMC meeting. And that was kind of how he outlined his most optimistic viewpoint of the near future.
Dr. Baker, could I ask a question out loud?
Absolutely. Who's talking?
It's Maddie Epstein.
Hi, Maddie Epstein. What would you like to ask?
So this is probably geared towards you and Dr. Sweka. And I know, as you guys said, everyone has an opinion, obviously. And I know our M1 and M2 year, we got to have those dean's lunches where we kind of got to voice our opinions on curriculum assessment, that kind of stuff. And I know there's lots of groups right now that are kind of starting to talk about it. But for those of us that aren't in groups, is there any way that, like, whether it's Zoom sessions or if people who do want to be included or have opinions on these, whether or not you want to hear them, but on these matters, is there a way that we could either kind of voice those or stay informed?
So the short answer, yes, absolutely. I guess the longer answer is and people can feel free to put something in the chat or otherwise give an opinion, is that an issue dependent thing? Would you like to just have something virtual that's like a dean's lunch? Because I got to tell you, the dean's lunches have been very sparsely attended this year. So the first and second year students are not finding that a way that many of them are choosing to reach out. So but absolutely, yes. One area that we're definitely going to be getting a lot of student input in is in the third year, we are really thinking hard about the grading system and whether we think it's equitable, whether we think it's sustainable over the course of the rest of this year. And we have had several very energetic conversations about that. And I can tell you that clerkship directors are not in consensus, that SCAC does not have a consensus, that any students I've talked to, there's not a consensus, and we're going to have to really work out the pluses and minuses, and that we will be asking students who are interested to give us their opinions. But anybody can send me an email and give me some ways that they think they'd like to connect, and we're happy to arrange that.
Beth, I wanted to add to that. Maddie, thanks for asking that question. So there's another opportunity as well. Judith Bussey is going to start, actually we already have together Zoom calls for students to come on and connect directly with me and ask questions as well. I know Dr. Rumoro was doing this as well, I think once a month or once every other week. We're going to do this by Zoom now. And we had one, I think, about a week ago, and we're going to have one, I think, at least one a month. So you'll have multiple opportunities to voice your opinions, raise your concerns, whatever they may be, and so we can all address it. I would encourage you to make sure you keep an eye out for those notifications and participate in those.
Great. Thank you guys so much.
And always feel free to reach out to me. I'll be meeting, I meet with the SCAC for the M3 class on a monthly basis, but we did decide last night we'll be meeting on a more regular basis for the time being. And I'm happy to meet with anybody. Anybody can feel free to email. I'm happy to chat anytime. So.
Yeah, I guess just the one other thing I'd say is like maybe something geared more toward like, obviously this is helpful, but just towards like the M3s or M3s and M4s in the clinical, just to have it more geared towards those specific questions.
Sure.
Absolutely, Maddie. Thank you. Jill Volk did put an answer, some information about financial aid situation. So for those who are interested, you can look on the chat, and she put in a link. So please, and just so I think everybody knows this, but if you don't know, Jill Volk within our office is the most expert person at financial aid. So if you're feeling unsure or unclear, ill at ease, and you feel like you'd like to run something by or figure out what resources you should be using, Jill is a resource for you. So do feel free to reach out to her if you've got a specific question that you don't feel has been answered to your satisfaction. I forgot to answer part of the question about what the M4 year is going to look like next year. That's an even bigger crystal ball. I imagine that next year there will be a limited ability for students to go other places, because I don't think we're going to be on this lockdown, but I don't imagine it's going to be all opened up either. So I think in the fourth year, we'll get back to a normal schedule. I think we'll probably have limited numbers of away kind of things that students will be allowed to do. But again, we'll have to see what happens. I would be surprised next year if they didn't continue to do virtual interviewing, because I think that's really opening up things, making things less of a financial hardship on students. But this year, there are obviously going to be kinks the first year it's done. So I imagine it won't look quite the same, and maybe there'll be some sort of hybrid. That is totally a guess on my part, though. So there's my guess on that. Okay. Another question about are we concerned about a rising number of cases for people coming in to do interviews this year? And actually, my easy answer to that is not really, because we're not having people in large groups. Everybody's masking unless they're by themselves, and we're wiping stuff down. So I think that we can feel that that's not a high risk thing, and something we will continue to do. I think the biggest risk you guys have as students, honestly, I think the biggest risk you have within the academic facility or within the medical center is eating lunch. And that sounds kind of funny, but I actually think that's true. So you're pretty safe as long as you're keeping your mask on. I think you can, I see patients, and we can't keep I can't keep 6 feet apart from somebody when I'm listening to their heart. But we're keeping masked, and that feels very safe. And I think the statistics would bear out that's very safe. When you eat and drink, you take your mask off. When you eat and drink, you put your stuff on a table and you lean next to each other. So I actually think that eating a meal and drinking is where you guys are having the most risk. So I would really suggest that if you're going to eat together, that you really do stay 6 feet apart. And for the most part, if I was really trying to be careful, I would go eat by myself. And that's what I've been doing, is eating by myself at my desk, or being at home, and then I eat with my husband. So if he gets COVID, I'm getting COVID. That's just the way it's going to go. All right.
Dr. Baker, sorry to interrupt there. I think Katie was actually specifically asking, we've been providing interview spaces for students, and if cases start to increase, will we not be able to provide those spaces for students anymore?
Yeah, I think we'll still provide spaces, because I don't see that unless we think it's an unsafe activity. Now, could the academic facility be shut down altogether? In theory, that could happen, but that would be a huge move, because we need the academic facility in order for our clinical students to be able to have a space to go do things so that we don't overcrowd the workrooms. So we need the academic facility to be open, because we need to have places for people to go so that they can get out of patient care areas when they're not taking care of patients. And if the academic facility is open, then we have rooms for students to do interviews. So I feel pretty confident that we'll be able to continue providing rooms. Now, if you've got a good space at home and it's getting, the numbers are going up, it would be really great for you to utilize your space at home, so the students who don't have a good space at home can still use the spaces that are here. Thank you, Jamie, for clarifying. Only one student brave enough to take off their mute and actually ask a question?
I have a quick question.
Who's that?
No, Michelle Kaplan.
Michelle.
I had to challenge the bravery thing. I meant to actually ask this earlier about surgeries. I haven't heard anything about elective surgeries getting like reduced or anything like that. But I guess just for those of us starting a surgery rotation, do you know if can we find out some information about that if surgeries are going to be reduced, anything like that, anything's going to change like that, if you know?
Dino, maybe you could answer. Yeah.
Thank you.
Yeah, I could answer that. So at this point, we are doing everything we can to keep surgeries going. And in fact, we had a record number of cases yesterday, 105 cases. So we're keeping surgeries going. Now there is some selection being placed in the types of surgeries that are being asked to be delayed until later. So there is not an intent to cut down on surgeries. You're starting to see that in the news. Other hospitals are doing that because of bed constraint issues. So obviously this is an ongoing discussion. We report out on this every morning in the hospital command center, which meets 7 days a week. So no expectation right now. Obviously, if the governor steps in like he did last time and says no elective surgeries, that's a different story. But at least for now, we're trying to keep all surgeries going.
Okay, thank you so much.
You're welcome.
Yeah, so I'll take that as a springboard to talk a little bit about the clinical rotations, because I've got a lot of clinical students on this call. I need all the students to realize that, number one, we are really committed to giving you guys the clinical education that you need in order to move on, in order to graduate, in order to become, our healthcare workers, and we need you. And so it's going to take a lot for us to pull you out of the clinical environment. It's going to take a lot. I think nationally, people were very quick to do it in March because we didn't understand COVID. We didn't understand how it was transmitted. We didn't understand how deadly it would be. And we are much better at taking care of COVID now. So we have a fair degree of confidence about what we can do in relative safety. But one thing we know is the more we crowd people together, the more likely it is that people are going to get COVID. With the closing of Stroger to student rotations, and that is unlikely to reverse anytime in the near future, we are more crowded. So what we are doing, and I know it's a hardship for you guys, is we are going to need to utilize evenings as much as daytime. We are going to need to utilize overnights for people. We are going to need to have people work on the weekends. And we are going to ask people, if they aren't going away and if they're not celebrating a holiday, to potentially work over holidays, because that allows us to take that more concentrated group of students and keep people away from the COVID patients and spread them out over time. Because if it goes up, we probably will have a relative decrease in surgical cases. So it's easier for us to give you cases if we can work around a larger schedule and be more flexible in what we're doing. Doesn't mean that a specific student is going to be asked to take on something that's a hardship for you for a specific reason. But for instance, if you can't leave your house and it's the week before a holiday and you're not going anywhere, what does it matter maybe if you work or not, if you get to be in a place where there are less other students and where we feel like we're able to increase the safety of everybody. So again, we're not going to ask people to do things that are sacrificing more than we're asking ourselves to sacrifice, and we're going to ask everybody to do their part. If it's, if we're asking you to do something that's really unacceptable to you for a personal or other reason, we're going to work with you with that. But if everybody can volunteer, and if everybody can understand that that's what we're doing, we're not doing it because it's more fun for us this way. We're doing it to try to take a situation that we have, give you guys the core foundational experiences that you need, and keep everybody as relatively safe as we can. And I don't know if any clerkship directors want to chime in on that, or if Dr. Zwecka, you've got anything else you want to say about that.
Dr. Baker, can I ask a quick question in regards to that?
Yes, who's talking to me?
Eleni, I'm one of the
Eleni, sure.
So over dedicated, like when this all started, it was made pretty clear to us that we were non-essential workers. If Pritzker was to say that there was to be a stay-at-home order where only essential workers are to work, would that distinction change, or
Probably.
would it be pulled?
So you're not essential workers for us. The distinction we're making is, as opposed to having you continue to work when you've had a major exposure to COVID, the legal people here have said, no, we need you to quarantine because of the risk involved. On the other hand, we need you to get it's essential that you get your education, because if you don't get educated, you don't move on and you don't get your MD, and then you can't be part of the workforce. So I think that even if there was a stay-at-home order, we would continue to do clinical rotations. Now, if the governor said no medical students can come to work, well, then we'd obviously follow what the governor says.
Thank you.
Yep.
Dr. Baker, there was a question about, this is Parya, in the chat box. Have there been any thoughts on coordinating or supplying transportation to the hospital? I don't think you've answered that one yet.
I haven't, because I can only look at one place or the other, so I got my eyes off the chat box. There are no current plans to do anything organized with transportation. That's a difficult question, because every form of transportation sort of has its issues. It is an active discussion that we've had, and I guess I might ask people asking the question is, what is there a suggestion of what you think would be helpful as far as transportation goes, and how would you see that working? We certainly have encouraged people to carpool together if they live close to one another, though on clinical rotations that it's a little harder to do, and since our pre-clerkship students are only coming in for another week. Do you know or Badri, I don't know if you have anything you want to add.
Hi, Dr. Baker. It's Clara. I was the one that asked that question.
Okay.
And I was just wondering, because I know in the past Rush has had like a safe ride shuttle that was like a mile of the hospital. And I guess like personally, when I've been biking, but like when I have taken the bus, it's just that the amount of like adherence to mask wearing is pretty low. And I think that has been the concern. So honestly, just if Rush was running a shuttle, I would walk to it and kind of time my commute. Let's say they go every half hour, every hour. Even if it was like the same number of people on the bus, knowing that it was like all Rush students or Rush faculty who would be wearing masks, I think I would be more willing to take public transportation in that way.
So we're thinking about the shuttle. I can certainly take that up to university leadership and we can have that conversation, because you're not the first person to tell me that there's an issue with mask wearing with the shuttle service. Certainly, you should let us know, because that's unacceptable from my perspective. And, I don't mind telling people that. So I would, if I was here, I'd walk right over to the shuttle person and tell them to go put on their mask. But we can work on that too. But I'll take your suggestion up to the university.
Oh, I actually meant I actually haven't taken the shuttle. It was like on the CTA. Like I take the Ashland bus, and like going home, there's probably at least 3 people that aren't wearing a mask. So I'm assuming that on the shuttle, if it's just people working in healthcare, there's probably going to be a higher adherence to everybody wearing a mask. That's kind of what I was suggesting.
Okay.
I don't know if you can hear me, Beth. Can you hear
me?
We
can. Yep.
Yes.
Oh, great. In terms of the transportation, thank you for asking that question. And, that's a good point you make. But we're also thinking about transportation to clinical rotations that are far away. And we are bouncing around some ideas of providing transportation for students who go to maybe Copley and other faraway rotations. It's not yet finalized, but we're working on figuring out how they can get there and make it easy for them.
Thanks, Dr. Konety.
Hi, Dr. Baker. This is Christina. To follow up Clara's question, I just would think maybe if the shuttle could expand their radius to be like greater than a mile, maybe that would be helpful for students that live like a few miles away and would not want to take public transportation. I don't know if that's a possibility.
Well, I think anything's up for, up for discussion. And so, because you guys are needing to get here, there are also PA students and nurse practitioner students and audiology students and, lots of other people who are experiencing the same thing. I just can't speak for the logistics of it and whether or not it's going to be practical, but I will definitely, we'll talk about that. And Dr. Rumoro and Dr. Konety will also think about how we might make that happen.
Yeah, one thing to keep in mind, we were looking into this the shuttle capacity has also decreased now because of COVID. We can't put too many people in a shuttle, and I think it's only like 6 or 7 people. So even if we extended the radius, depending on how many students would be using it, we may have to starts figuring into it because we can't load up too many students.
Right.
There are many nuances to this, but you raise a good point, and we should look into that.
All right, I've got a question about doing rounds by phone when you're on clinical rotations. Okay. So the question is, I'm doing rounds in the conference room, and is it any different if I was at home? And would it be safer? I guess I could extend that. Would it be safer for me to be at home and to take a day on the rotation where I'm on site and a day where I'm off site? I think that is something that the clerkship directors have been thinking about and planning. I think that for each clerkship director, there's the push and pull of whether there's going to be the opportunity to do patient care that day. And even if it may not be a full day of patient care, I'm just telling you that every patient care experience right now is really precious to us. We don't have extra patient care experiences that we can just throw around. And so if we need to do something where you're on and off, but if there are whole days that would be off-site, then I think there are some people who are having students stay at home for a day and do something virtual. And it's certainly something to bring up with your clerkship directors who are absolutely interested. We're interested in doing what is going to work the best for everybody. So I can see Dr. Zwecka taking notes, Dr. Van Alp still thinking about it when the puppy's not crawling over her.
Anyone wants to be happy, you can see my cute puppy.
All right, everybody take a moment while Dr. Van Opstel shows us her cute puppy. Where is it?
Desk, hold on. I'll show you in a minute.
Okay.
Puppy.
Oh, there we go. Okay, cute puppy. That's a way to get your wellness going.
My messy house. But on a more serious note, if any of you guys as clerkship students have any concerns or suggestions, I think all of us as clerkship directors are open to them.
Yeah, just as the neurologist on the call, I think I think there's a bit of a balance because as with every other clerkship, there are clinical skills that can't be attained without being in person. So make sure to talk to the clerkship director about your concerns, but there are other components than rounds. So I don't know what else is going on necessarily during your day, but the other things may be also important.
Yep. So just for the students to, again, do a little level setting, remember that this is a new experience for you, but we also have not been through a pandemic before. So this is a new experience for us. And for a lot of us are a lot older than a lot of you. So, it's harder for us to change. It's harder for us to innovate. It's harder for us to think about lots of different ways of doing things. So you may have ideas that we don't have yet, and we want to listen to your ideas. But it's, we're all making this up as we go along, because we've never had to figure out what's the minimum number of clinical experiences that's enough for a student to move through the third year. What's the minimum number of patient care experiences that allows us to feel good about putting a Rush Medical College MD after your name, and that we can feel confident that you could go on and take care of patients? So we are all working on this together. Something for the clerkship students to know is we have set kind of a hard stop at the 50% mark. So for instance, the internal medicine clerkship now, which is an 8-week clerkship, turned into a 6-week clerkship, and is now turning into 6 weeks of patient encounters, is now turning into 4 weeks of patient encounters for right now, because we lost Stroger and we have a lot of COVID in the hospital. It's all on internal medicine, and that's where we drew the line. So realize we're tight. And other services are going to be thinking about the same sorts of things. So as long as we can get 50% in authentic patient experiences, the other 50% may be simulation, maybe paper cases, maybe telephone encounters. We're considering that okay, and we think it is okay. We've given a lot of thought to it. But that will have to be borne out to see how that works moving forward. So we are constantly trying to figure it out as we take what we have and we try to make it work. All right, Beth V says, thank you for the old faculty members. Okay, Beth V, oh, you're a new relatively new. I'm the old one. So, but yes, thank you. So Dr. Shaw of the Ami Shaw, not of the Syed Shaw, although Syed probably wants to know too. Can I ask how students are feeling about clerkship experiences? So any feedback any of the students would like to give us about their clerkship experiences so far? Now you really have to be brave, because there's a lot of people on the phone.
Hi, it's Chris. I'll take a stab at it. I appreciate all of the hard work and effort that everyone's been putting in, the way that we've been having to adapt to very rapidly changing things that are going on. I think for me, it's keeping that in mind. But as a student, I think it'd be helpful if there was some transparency in the decisions that are being made. Like, for example, the IM rotation, which is what I'm on now. Understanding what went into that, because of course I know that, again, everyone's doing what they can, but I think that will help us. And the example I think I've been giving is like when you talk with a patient, you prescribe them medication. They're a lot more invested when you explain what the benefit is, why this would be helpful for them, and things like that. So I think that would just help me feel a lot better about things.
All right, well, thank you for that feedback. And we are doing our best. Remember, that change just happened as Stroger rather suddenly, without any warning, decided to pull our students away. And at the same time that we had a rapid increase in COVID. And so it became a math problem on internal medicine with how many students we could accommodate and versus how many services we still had. And I think I see a hospitalist, Dr. Sai, who perhaps can tell us in the last week what's happened with the general internal medicine and GMF teams on medicine.
Oh, I mean, can you hear me?
Yep.
Okay. Yeah, I mean, we've been changing units too. Medicine, for those who third years have already done it, used to all be in the atrium, and now we're in Kellogg. I'm staffing with both OBS residents and my regular team. I walked into pre-call, which normally we'll have 5, 7, 10, maybe 10 patients, with 16 patients. And I'm on call right now, so it's quite busy. And yeah, I think, as Dr. Baker said, part of the problem is that we have a lot of patients. It's just that a lot of them are on the COVID units. And so right now, from a risk benefit standpoint, in theory, if COVID were something that were not communicable, then we might be able to put more students on there. But I think right now it's tough. And the other problem, because I'm like, oh, could I take another medical student? But the workrooms are so small. Then I saw Malcolm had a question, and I don't know if Dr. Baker or one of the clerkship directors wants to address it, but I think he asked, like, his neurology rounds, he's listening in on the phone for his rounds as opposed to being in person. We're not doing that on medicine, but it does make it tight. We're adding another person would essentially send all the students away, and that would not be so good. The patients are pretty sick. I think for those of you who are on medicine, given that it's 4 weeks, I would say try to see as many patients as possible, and be willing to stay late, right? I'm still in the hospital. I'll probably be here for another couple hours. And so will the residents. So as much as possible, kind of stick around and try to learn from all the patients that you're not following is what I'd recommend.
Great. So I will definitely send that message through Dr. Zwecka to all of the clerkship directors, though. It sounds like you guys as students would feel better if maybe every week, the beginning of every rotation, we gave you sort of the background, because even the background we give today may be different in a week or two as to why the rotations are set up the way they are, why we're asking people to do the things we're doing. I am sure that the clerkship directors already think they're doing it, but it sounds like there's some room where we could do even better. So we'll be sure to pass that message along.
And Dr. Baker, it's Laurel Cherian, one of the neurologists. So to Malcolm's comment, the rounding rooms for some of these services are quite small. So I can't speak to the general neurology service, but for the stroke service, it's a table that really should be able to seat about six to eight people. And you've got an attending, a fellow, a senior resident, a junior resident, 1 or 2 rotators, a nurse practitioner, and 4 medical students in a room that, is, frankly, the numbers for that are not safe. So I think some of the video rounding for, like having a WebEx and then having another portion of the team elsewhere was really just to maintain safety. And the goal is really that when you present your patient, however many patients you're following on bedside rounds, you physically, get to go in that room and maybe examine the patient with the attending watching you, or be there bedside with the attending, and trying to really preserve that in-person portion where you're actually seeing and doing that physical exam with the attending present. So, but I think certainly for any, neurology or any clerkship, if you're finding that that's not a high yield experience, or, if you feel like it's suffering, I think, just giving feedback, because like others have said, I think it's flexibility and, just trying to find creative solutions in a unique situation.
Other questions?
No, just in, Dr. Baker, it's Johnny Alvarez. For me, so in terms of I've been very thankful to be able to have been going to clinic, loving most of my time in clinic, most of my clinical experience. I think just and I'll speak from, obviously for me, just there is a certain level of questioning that is going on in my mind of how good of a doctor am I actually going to be when I become an intern with this limited amount of time? And I understand everybody is doing what they can and very appreciative of that. But even when I hear well, we'll do paper cases or simulated cases, just there is a fear in my mind that is not the quality education that will lead me to be a good doctor.
So Johnny, I think you're saying what everybody on this call is afraid of is, are we doing something that's going to be harmful to your development as a physician? So a couple things. One is, we got, for the third year students, we've got a whole other year after this, and maybe we're going to need to, give you guys some additional weeks of some good patient care experiences to try to help catch you up in the areas that you're going to be pursuing. I mean, we all doors are still open when you think about that. The other thing for all the students to remember is, you're in medical school. You're in medical school because you're a particularly intelligent and talented person. And you are the kind of person that makes things happen, and you are the kind of person that finds a way to be successful. So if you're a little bit behind at the end of your third year because you didn't get the experiences that you would have had in a normal year, I promise you will figure out a way and you will make it up We are amazed every year at how the beginning of the third year students are like deer in the headlights. They don't understand what a clinical experience is. They don't know what they're doing in week 1. By week 2, they're better. By the time we're on the second rotation, it's amazing. By the time it's the third month of things, we can hardly tell the early third year students from the late third year students. So you guys learn at an incredible pace. And I am really confident that you'll make it up if there is something to be made up in the fourth year. And if you need to, and if things don't, aren't as smooth as I'm hoping they're going to be, that you're, when you start your internship, people will give you the extra experiences that you need, and you'll get where you need to be. A lot of it's the effort on your part to make a paper case seem almost as good, to work with what you've got. You take the substrate you've got and you make the most of it. And you guys will. I have really great confidence that you'll all become excellent physicians. We don't know how for elective time works. Is there a way that some space can be reserved? Absolutely, yes. And we are going to see what happens between now and the spring and figure out what everybody needs. Just so everybody knows, the core clerkships are really important, but getting the fourth year students everything they need to graduate is number 1. Always will be number 1. It's just that there's a lot of space in the fourth year for people to explore the things they want to do, for people to get extra training in the areas they want. If we feel like there's foundational material that still people need to learn and foundational patient experiences that are needed, we will make that happen as soon as we have the opportunity to do that. So fear not. Dr. Zwecka is magical with her ability to move pieces, shuffle pieces around and get everybody what they need. So she will work to make sure that happens. Any other questions or any final remarks that anyone wants to make? Okay, well, I just want to take a moment. So everybody, we're all stressed. We are all in this environment we've never been in before, but we are all here together for the students, these faculty members that are on, and the staff that are here, and the people that aren't on the call, but they're here because they want to teach you, because we are invested in your success, and we are not perfect, and we are stressed too, and we have sick parents, and all the things that you're worried about, we're worried about those same things. So we have to be really kind and understanding to one another, but realize that you've got a team of, fantastic faculty that are here wanting to just absolutely do the best for you. And the faculty, you guys know that it's hard right now, and we are working around the clock, but it's for a good reason, because we have patients we're taking care of. We're going to get through this, and we have you guys, you students, who we are shepherding through to try to make sure that you get what you need to make it from here to the end, which is getting your MD. So if there aren't any other questions, does anybody want to say anything else? All right, guys, I didn't think this was going to be an hour and a half, but it looks like we came pretty close. So thank you, everybody. I will stay on in case anybody has a question that they didn't want to ask to the group, and we are always available, okay? Thank you very much, and we'll have more town halls in the future, okay? Bye-bye.
Thanks, everyone.
Thank you, everybody.